surprised to learn that millions of us experience a fall, especially at this time of the year. And we're pleased to have back with us Dr. Chad Trierweiler with Urgency Room. So thank you for being with us. And before we started the show, I was mentioning that I just had a friend of mine where his daughter, 46 years old, apparently was home alone and fell, hit her head, and she passed away. Very tragic. And so that's one extreme of the what can happen. But falls are very common. What are you seeing in the urgency room?
Yeah, this is a very popular time of the year. It's kind of hard to call it popular, but that's what we see is a lot of falls, often kind of that November, December range, and then now again into March and April.
And why this time of the year?
I think it's just people, when we know that it's cold and it's snowy outside, people are prepared for it. They've got their boots on, they're ready to go. But once things start to warm up, like this past week where it was 70 and now today it's only 30 again, that little bit of snow that melts, it creates that black ice, and people just simply aren't paying attention, and they walk right out the door with their either with their nice high heel shoes on or their non-slip soles, and they end up slipping and falling.
Or heeled boots. Yeah.
Right, exactly, and down they go. And I think they're just very surprised by it. But that's what facilities like ours are available for, to see you if you have a fall.
So what types of injuries do you usually see from the falls? What are the most common?
Sure. Typically the central core is pretty well protected. Our reflexes reach out for that. But what does that mean? Hitting the head, reaching out, breaking a lot of wrists, and then otherwise stepping wrong or sliding and ending up breaking an ankle. And so I'd say there also, as we get a little older and the bones get a little more brittle, often hip fractures and pelvis fractures are common as well.
So when you have some of these injuries, how do you know when you should be seeking emergency care? When should you be going to the urgency room?
Right, and that's a question we get a lot of. I don't know whether this should be checked or not. I guess I'd start with head injuries because of all of the falls. I mean, we can fix bones, we can make those things better, but you only have one brain. It's still pretty tough to fix that if you suffer some type of a devastating injury. For the head, a few high-risk things. First of all, we would want to know what type of a mechanism was it? Are you falling off of a ladder or just a slip, on one or two steps? Where did you hit your head? More in the front or the back? The side areas are the weakest areas where the bone is the thinnest, and you're more likely to suffer significant injury. And then from there, how did you feel afterward? If you've witnessed your loved one suffering a fall, was there a loss of consciousness, or was it just that brief moment of seeing stars, or was your loved one completely out for 2 minutes? Once they do come to, do they remember the event, or are they more confused? And then the big ones that we look for, without a doubt, is once you get bleeding inside your head, there's no room for that blood to go. So it just starts to expand and expand. It puts pressure on the brain, and when that pressure gets placed, you start to get really sick to your stomach. Anyone who vomits more than once after hitting their head needs to be scanned. Also, they'll get more confused. They can get very sleepy. And so any of these mental status changes where your loved one just doesn't seem to be acting right after they hit their head, that would be absolutely a prime time to take them directly to a facility like ours, or even to consider calling 911, especially if they're certainly off of their baseline.
And the injuries you were saying can vary depending on where you hit. And can you kind of talk about some of the type of the injuries that they incur if they're hit in the back, the top, on the side?
Sure, of course.
Like
I remember having a smart teacher growing up discussing how the face was made to be a perfect crumple zone, where if you get hit in the forehead, you get hit in the face. Yes, you suffer a lot of trauma to your lips and your teeth and your nose, but it really protects the brain. And so frontal injuries are actually the safest ones. On the flip side of the coin, hitting the back of the head, again, the bone's pretty thick there. Most of the devastating cases we hear of are those where they fall and they hit it right over the temple or the side of the head. Just the bone is thin. There are a lot of major arteries that run right along those temple areas, and so a fracture there can certainly cause bleeding and cause devastating situations like you were discussing with your friend's family.
Yeah, and it seems like every year we hear of a couple of people that are even on the snowboarding or skiing, again hitting their head, telling everyone they're fine, but then an hour or less later, they're very sick.
Sure.
So-
And you know, the important thing with skiing, with snowboarding, with hockey, fortunately most people are getting the message how important it is to wear a helmet. Wearing that helmet gives that extra bit of cushion, so that way instead of the brain slamming into the skull, it has just that little more give, that slowing down mechanism, so that way you don't suffer a brain bleed. Now keep in mind you can still suffer concussions and have issues with that as well. But again, those are rarely life-threatening, and it's those bleeds that really get you in trouble.
And concussions, it's not something that shows up on a scan at all, right? For the most part?
That's correct. And I'd say that's probably the vast majority of what we see. A mother sees their child fall, and they just want to make sure that they're okay. They may be a little nauseous. They may just be not quite firing on all cylinders, and they come in to see us. And the great part about the urgency room is that you have board-certified emergency doctors there to look over these children and determine who needs that CAT scan and who doesn't. And once you've gone through the CAT scan, if we make sure everything looks clear, then we can give guidance of concussion injury, of making sure you don't hit your head a second time, avoiding doing a lot of high energy sports or other chances where you could suffer a second concussion, and then discuss ways we can get through that as quickly as possible and set up follow-up.
Because it's those multiple hits that can cause severe damage,
Oh,
right?
without a
The
doubt,
more
yes. We call it second hit syndrome, that a single concussion is rarely anything too serious, that most of the time you will completely recover from that. It's rare to suffer any IQ points being lost or anything there, but certainly if you get a second hit, a second concussion right where the prior one was, that brain tissue is, it's susceptible to having more serious injury, and you can come out of that with long-term hearing issues, long-term balance issues, cognitive issues where you just may not get back to your baseline, and that's why we are very adamant about making sure we stay away from those secondary chances of getting hit with other contact sports.
So, and I understand too, the older we get, the more likely we are to experience a fall.
Well, of course, yes.
Yeah.
You watch.
Your balance.
Yes, I have small ones at home, kids, and it's just amazing how quick their reflexes are. It makes me feel very old that you start to tip over. A lot of that just is a slowing of the reflexes, a slowing of the brain power. But more than that, as we get older, we often become less conditioned as well, and so our hips are not as strong, our cores are not as strong to grab out and catch something to stop us from falling. And so certainly as we get into the elderly ages, yes, we see a lot more falls there where they just aren't able to catch themselves.
So would exercise, especially exercise in the core part of your body, would that help to prevent some of these falls?
Oh, absolutely, absolutely. That just we remind people consistently just to get up and keep moving. That once you become so sedentary and you sit and sit and sit, all of those core muscles just become weaker. They simply don't have the strength to help you respond. And so any type of a physical fitness exercise program, much less just simply going for a walk and strengthening those muscles, can be very helpful.
But be careful where you're walking.
Of course, exactly. This time of year especially. Yes.
Other tips or advice for our viewers on preventing falls, seeking treatment, things like that?
Sure. Just being cognizant of what the weather conditions are and what it is that you're wearing that day, and just being aware that this time of year you just have to be extra careful. But beyond that, it's just being smart. It's Minnesota, right? And so the fall and the winter happens, the freeze and the thaw happens, and just being cognizant of the weather condition outdoors.
I just think people would be really surprised to hear that you're at a higher risk at this time of year than maybe some other months and things
January
like that.
or February, absolutely, absolutely.
And preventing, always try to keep moving, things like that.
Sure, just strengthen the body. It's the only one that you have, right? And so just sitting all day long will not help you when you are actually up and moving. So anytime you can strengthen that core, strengthen those legs, just allows you to be better prepared for any falls.
And as we were talking before the show started, aside from, to change the topic just a little bit,
Sure.
that we're seeing a late insurgence of flus. It's typically more during the holidays to the first of the year, but I'm hearing a lot of people suffering from different viruses and flus and stuff. What are you seeing in the urgency room?
Yeah, the CDC did a great job this year setting up the flu vaccine to make sure everyone was covered. So with those of you who got flu shots, we're seeing a much lower incidence of flu this year compared to last year. However, yes, the Minnesota Department of Health just put out last week that we've gone from sparse cases of flu to now widespread here in Minnesota. And boy, have we seen it. I was at the urgency room all weekend been long, and I think, what, of the 70 or 80 patients I saw, 6 or 7 had the flu, true positive cases, and we treated a number of other ones presumptively, saying we're anticipating that's the case. And so it is definitely out there. Influenza B is the one that we're seeing a lot of currently. There's an A and a B strain. The A was well covered by the shot. The B strain often comes a little later, not as covered as well with the shot, and so, but we're seeing many people with that now.
How about who's it affecting mostly, but what type of the population is being affected by it?
Yeah, that's the challenge, is that the flu doesn't care how young you are or how old you are. We're seeing it a lot in office workers, people who are around, their same age group. I'd say between 20 and 60. I've seen a couple college students recently with it, but the challenge is that they bring it home then, and then they pass it around to everyone else in the house. It's just a very contagious virus, but fortunately the strain this year is not quite as strong, not causing as many problems.
And those symptoms that you're seeing, and
typically sudden onset of just all of a sudden feeling like you've been hit by a truck. Oh my gosh, my neck hurts, my shoulders hurt, my back hurts, a temperature suddenly comes right after that, and feeling that shaking, cold chills that can happen. Often people will have respiratory symptoms, a runny nose, a cough, but those are nowhere near as bad as just feeling so cold and hurting all over the body. And often the best treatment is what Mom probably taught you, a little tender loving care, a little soup, ibuprofen, lots of fluids, and rest, and staying home. And it takes at least 5 to 7 days before that virus gets completely out of the system. So most people are out of work for a little while.
And when should they go to the emergency room with flu-like symptoms?
So I guess the biggest issue would be if you have other comorbidities. You're certainly elderly or very young, under 6 months of age. If you've got already an issue with heart problems or lung problems where those areas can get compromised easily. If you're so weak that you're not able to get to and from the bathroom, to and from the kitchen, not able to drink the fluids that you need to catch up, those are the very high-risk folks. Now, across the board, most 20-year-olds, 40-year-olds, 60-year-olds are going to fly through the flu. They're going to have a rough week, but most of them will be fine.
Are you seeing along the same lines an increase in pneumonia right now as well, especially among the elderly?
Sure, it's this time of year, of course,
Yeah.
right, for pneumonia, and certainly all of the other upper respiratory viruses going through can wreak havoc on the lungs and get you set up to be more likely to develop a pneumonia. But sure, pneumonia we see year-round, we really do, because it's always out there. But certainly as we are stuck indoors and passing these both viruses and bacteria around, we're seeing a lot of pneumonia too. Sure.
Final tips and advice on treating, preventing the
Sure.
flu?
It's easy to say, hard to do when you're coughing. Trying to get into your arm, into your hands, washing them regularly. And I guess the biggest thing is that if you feel that sick, that you just feel absolutely run down and awful, we all think we can tough through it and we're going to go to work, but actually you're harming your fellow coworkers more than just staying home that extra day and recovering. So.
All right. And if someone wants some information about the urgency room or where you're located or
absolutely.
to make an appointment?
We have 3 freestanding emergency facilities, one in Woodbury, one in Vadnais Heights, and one in Eagan. We are open 365 days of the year from 8 in the morning until 10 at night, and we are able to see you for literally anything that might be causing you problems. So come on by.
Dr. Trierweiler, great to see you again. Thank you for coming back.
It was my
Always good
pleasure.
information.